Our guest today is Rafid Fadul, and he's the embodiment of entrepreneurial spirit in medicine. Rafid saw a problem in documenting medical compliance and solved it with Zivian, a compliance and quality control platform. Dig a little deeper, and you'll find Rafid the pulmonologist. He worked 24/7, saving his patients during the early years of COVID. He's also a leader in health and longevity medicine. Rafid, what problem does Zivian solve?
First of all, you're overly kind, and I think I'm going to take you with me as like a hype man everywhere I go. So Zivian solves a problem that I saw really throughout my experiences working in health tech, working in the front lines during COVID, and then also working in just kind of traditional healthcare settings that were non-emergent. What we are all facing right now is a very quiet crisis, right? So doctors like myself are dwindling in numbers. The demand for physicians and healthcare is actually going up for a multitude of reasons, including life expectancy and expanding population size. But this gap is now widening, right? So who's filling that gap? It's non-physician providers. That can be nurse practitioners, physician assistants or associates, even nurses, pharmacists, you name it. It's not doctors anymore, and that's good. We're getting care somehow, but the problem is there is no robust infrastructure to support these folks who are stepping in to fill these gaps, and that's really where Zivian comes in. So we started with a marketplace to provide physician oversight, but we've evolved since then to get into workforce management, right? So the idea is that we support all providers, including physicians, to help meet the needs of our population as the care gap unfortunately expands.
Yeah, it's so interesting. I think I see nurse practitioner more than I ever see my own doctor. I don't think I've seen my doctor in years, but the
Yeah.
nurse practitioner is there.
Yeah.
So tell us about Zivian's business model. What can other entrepreneurs learn from how you developed and how you make money and raise money?
Yeah. I a lot of lessons. I don't know where to begin. There's so many. The two businesses I had prior to this that were sold were actually bootstrap businesses. So this is the first venture-backed business that I've done, and it's a little bit of a different beast. But I think if I were to distill it down to a few lessons, I think no, well, to answer your question around what our business model is, and then I'll tell you like what I can share after that. We have a marketplace model for the physicians who support these businesses who hire NPs and PAs and also support the NPs and PAs themselves. And then we also have a SaaS, software as a solution component where we have a workforce management tool. So you can imagine any company that hires NPs, PAs, or non-physician workers, they need some tools to help manage that workforce, and that's where we step in. So that's really where our model is. We like it because it's very scalable. Unfortunately, it's a huge need today, and it's a need that I think we meet pretty well, and allows these companies to scale and grow efficiently, and also really like have a good pulse on the quality of the care that they're actually providing. So that's really kind of what the essence of our business and the model itself. In terms of the lessons that I would learn, I would say, I mean, um, you have to really be committed to what you're trying to solve. And the reason why I say that is because there's going to be good days when you have like a lot of wins, and there's going to be bad months where it just feels like you're running through molasses. And so you have to the thing that carries you through those tough moments is the commitment to your mission, your goal. In our case, what I always think about is our invisible stakeholder, right? And so what I think about is this person that's in the middle of I don't know, like very rural Texas, or for example, right? This is a real story that I'm kind of leaning on here, who otherwise wouldn't have gotten care, but for the fact that a nurse practitioner decided to hang a shingle in that small town that's 3 hours away from Houston, right? Which is the closest major center. And the local people there was actually a local patient who couldn't get care for her son, who was a very poorly controlled asthmatic, who was missing school, suffering in school as a result of that, both socially and academically. And if this woman takes off work to go see a pediatrician, which is 3 hours away, and
Mm.
it's also gonna, it's gonna take her, she has to leave, like take a day off of work, which would actually cost her her job. And oh, by the way, that first available appointment's in 3 months, right? So meanwhile, her son is suffering the entire time. So like that woman and her son are the ones that I think about when I'm like, oh, these times are tough, right? So really be committed to like that invisible stakeholder who's, they're not using our platform, but they're deriving the benefit of us doing the work that we do.
So for the nurse practitioners, I mean, maybe you can simplify how it really works. You've got this platform, you've got the nurse practitioners who use the platform. What role are the physicians and who pays whom?
Right. So it's kind of a three-sided marketplace where you have the physicians on one side, and you have two components here. You have either the NPs and PAs who want to hang their own shingle and work for themselves, and then you have these enterprises. So more and more companies, more and more healthcare institutions are relying on non-physicians, and some say it's for cost, but it's also because like there's not that many doctors available, right? So you need to, and the demand for this care is exceedingly high. And so they're leaning on more and more on NPs and PAs to deliver that care. And so where the physicians come in is, you think for one country, we have a labyrinth of state by state regulations, not just, per state, but it's if there's nursing regulations, there's medical regulations, there's separate ones for the PAs. And they all change at various times. Multiply that times 51, right? So it can be a bit overwhelming if you're trying to be an enterprise working in these places. So where Zivian comes in is that we solve that. We're kind of the easy button for compliance. So say, hey, look, we can help you manage this workforce, activate them quickly. And in many of those states, and almost all the states actually for PAs, and more than half in the case of nurse practitioners, you need a physician supervisor by law, right? So someone's got to ride shotgun with that NP or that PA to be a supervisor, be a monitor, be a sounding board, be a mentor. And that's not to say that every NP absolutely needs this. That's not the case. I think that I've personally worked with exceptionally good NPs who could operate as good as doctors that I've seen. But it's really a team game approach. It's not about the doctor. It's not about the NP. It's about the patient, right? And so we should all be working as a team to support them. So yes, there are these mandatory regulations that require it, but where we want to foster this approach of multidisciplinary care, which has been proven time and again in different hospital settings as really the optimal way to go.
I mean, this regulatory situation with all of these rules being different wherever you go, location by location, are you using AI to stay on top of that? Or how do you stay on top of things that I believe you've told me they can change within a 6-month period? And somebody could get in trouble, right? If they violate one of these rules or regulations,
Yeah.
could lose their license.
Yeah, you lose your license, you lose your livelihood, and all of a sudden you're not feeding your family, right? It's a really big deal. So to answer your question, yes, AI, we have woven AI tools into our program. So we're constantly scraping boards of nursing, boards of medicine, state legislature websites, looking for proposed rule changes. If we see them, we validate them with outside counsel and impute them back into our platform. So our users, the physicians, the NPs, the PAs, they're never impacted by any rule changes because they're staying ahead of them with us.
That's a big thing. I mean, my next question is, what is the biggest challenge or complaint you hear from physicians about today's state of healthcare? You kind of touched on that, but you're working with these doctors do you pay the doctors, or the doctors get paid by the nurse practitioners? What's happening with the physicians in this situation?
Yeah, the physicians are getting paid typically by the companies that employ these NPs that require them, or even in some cases the NPs if they're hanging their own shingle and they're working for themselves. So that's usually how the payment structure works. In terms of what are these doctors complaining about for healthcare? I don't think you have a podcast long enough for this. Like I could tell you a whole list of things that the doctors are upset about. I think the big thing that we hear a lot of is, they want to be involved in meaningful care, right? Like these doctors, and I tell people this all the time, and that's actually the really special thing in my mind about Zivian is that, when I'm in the ICUs, I work with 15, call it, patients a day, right? And I touch those 15 lives and by ripple effect, their families and so on and so forth. When I'm doing collaboration mentorship and I'm working with an NP who's in Maryland or Oregon or whatever the state, you know, I'm touching all the lives that she touches as I work with her and I give her kind of, the tutelage and the guidance and be there to work with her as a thought partner. Now I'm creating this legacy that touches everywhere. And that's really, I think that's what many of us, why we went into medicine in the first place was to kind of like have that feeling that I'm doing good for my community. And now you're doing it in a way that's like very, very scalable, right? So you're not getting the direct impact of like, I'm not personally hands-on the patient, but I've now touched these multiple communities I would not have touched otherwise. And so I think everyone is craving that, and they like the physicians historically used to be the pillars of our communities, right?
Mhm.
Like when times were tough, you would go to your doctor, like for anything. It was an earthquake, you go to your doctor, like, the doctor's not gonna do anything, but like that's the position they held historically in society. And I think a lot of us still have that thought process in our head that we want to be net good for our communities. I know, like, doctors get beat up all the time in the news about the stuff that happens, like really in hospitals and private healthcare. And I'm not saying that we're all, saints. There's definitely some bad actors, and they should be rightly dealt with. But by and large, I think everyone goes into healthcare not because, like, oh, I want to go make money. There's much better ways to make money than going into medicine. I promise you that. And it doesn't cost you, over a decade of your life to do it.
So, if you're thinking about thought leadership, if you're just going to speak to entrepreneurs, not necessarily medical professionals, medicine needs new ideas. You had one. What's your advice to other thought leaders? And, what obstacles can they expect? Because you're solving for this deeply important problem. Maybe others are solving for something that's not quite as critical or sexy or, important, but there's
Yeah,
young people out there who are saying, I have some ideas. What problems, what obstacles?
honestly, I would say, like, and this is probably like the worst advice, but I would say do what makes you happy. Like, because, if you're doing, if you, I was talking to this with a friend of mine. She's like, oh, I think there's this issue here. Like, I see this opportunity to do this. It was like a pharmaceutical related business. And she hated everything about it, but she saw there was like a good money making opportunity.
Oh,
And I was like, yeah, you could. I wouldn't personally invest in you. And I think she's brilliant. I was like, but because you hate it. Like there's going to be moments that, like, you're not enthusiastic about it, and you're not going to want to continue. And so, like, do the thing that you actually feel like fulfills you, because you're going to need to work 80, 100, 120 hours. Like, that's a necessity.
well, thanks so much for being here, Rafid. It's been such a pleasure.
I really appreciate you having me. This was fun to chat with you. It was good to see you
Good
again.
to good to see you. Good to talk to you.